Hello, I'm Jawad, Husain, Exec Medical Director at ELHT. You probably are seeing a bit of a different background this time to my what previous messages has been. And there is a reason why we are in a different place and few members of the team who are accompanying me. And this is about the Discharge Week, which at ELHT we are promoting. And hence I've got colleagues Sharon and Katie with me who will take you through what happens in the process of the journey which a patient has at ELHT. Now, patient gets admitted, but the end point is a discharge, and that is a very important point in ensuring that safe discharges takes place. But not only that, the experience that it should bring to the patient and to the families. So I'll stop here and I'll hand over to Sharon and Katie. And one simple question, which I'm sure they'll run with it: what is the discharge unit, Sharon and Katie? And if you'd like to introduce yourself.
Yes, certainly. So I'm Sharon Reid and I'm the head of patient floor here at East Lancashire Hospitals. So what we're trying to do is promote the Discharge Lounge currently as part of the patient pathway. I think we all understand how under pressure our emergency department is currently. What's really important is the patients that are medically optimised and ready for discharge come out of those acute beds to free up the beds for those in the greatest need in the emergency department. The Discharge Lounge is a great environment for patients. We are open 7 days a week. We open from 7:30 in the morning till 8 p.m. Monday to Friday, and 8 a.m. till 6 p.m. on a Saturday and a Sunday. We want to really get the Discharge Lounge embedded as part of the patient's discharge pathway and as part of the patient journey. We get great feedback from our patients. In the Discharge Lounge, we've introduced a lot of initiatives to increase the number of patients that go through and really to improve flow throughout the hospital. Really do think it's important that we get staff and patients attending the Discharge Lounge, and I'll pass over to Katie to give you some of the further details what we can provide from a nursing point of view within the Discharge Lounge.
Hello, my name's Katie Topham. I'm one of the discharge matrons here at East Lancashire Hospitals, and I work with two other colleagues, Ruby and Nat, and we oversee and manage the Discharge Lounge. I think the main thing to realise about the Discharge Lounge is it offers a full MDT approach. So we have trained nurses, healthcare assistants, but we also have input from the front door therapy team who will assess patients to avoid hospital admission, and we also have aged UK colleagues who base themselves in the unit, and they will support with take home and settle services. We are also able to cater for patients in terms of dietary requirements, so we can order hot meals if that's what the patient would prefer, but we also have access to a breakfast trolley early in the morning, which means that if patients are able to vacate their beds early to help promote system flow, they can have breakfast in the Discharge Lounge. Alongside that, one of the initiatives that Sharon mentioned earlier, we also have access to a discharge welfare pack, and this is to help support patients who might be going home but family or friends, next of kin might not be available straight away to support. And what that pack will consist of is bread rolls, jam, cheese, porridge pots, some beans, some bread, and that's just to help that patient once they arrive home, should they not have somebody to support them in terms of groceries and food shopping straight away. And it's actually been found to have a really good impact on a patient's hospital journey, including that discharge process.
So, colleagues, you've heard what a fantastic service the team provides. And these are the unsung heroes, because they are the people who ensure that the patient, when being discharged, goes in a safe and comfortable environment. A lot of hard work goes into this, so a big thank you to the team. And finally, before I close, I would like to just mention that a few days away is the bank holiday weekend. I'm sure people would and do deserve to enjoy that, but please be sensible. Be sensible with the weather, especially it's going to get warm, and we do see a number of heat-related injuries, if I may say, attending A&E, so you can take simple measures. Ensure that you are hydrated, but also be sensible in what you take on as activities, because we do see a number of soft tissue and bony injuries by people who are probably not as careful as they should be. So look after yourself and your loved ones, and in a couple of weeks' time, I'll present possibly another team with another update in a different area. Bye for now.